Assalamu alaikum wa rahmatullahi wa barakatuh. So my name is Mohammed AlBreiki, and I'm the Acting Director of Applied Research and Capability Building. Plus, I'm a reference lab section head at the WOHA Collaborating Center for Camel Disease. I would like to thank the organizing committee for giving me the opportunity to showcase the One Health initiative that is implemented by ADEFSA. And thank for the two speakers, because they will make my talk now much more shorter. I was planning to spend 20 minutes, but they have highlighted the One Health enough for me. And I was really interested on the was shown by Dr. Yashpat is the market to ecosystems. It's a new concept for me, to be honest. And hopefully my talk will be like the a storytelling as the other speakers. So you get like a proper, I would say, image about the One Health at a global scale. So I will just give you a quick, I won't dive deep in actually the initiative that started by ADEFSA. I'll give you a nutshell because there are so many projects and that handled by different project manager, but I will showcase this initiative, and I will be very happy to connect you to the right people later on. So I will start up with the zoonotic disease here, and the reason why I mentioned this one, because this is the clearest and the strongest example why do we need One Health. And if you ask yourself what is zoonotic disease, is a disease that caused by, it's an infection that's caused by pathogen that transmitted from animal to human and vice versa as well. This infection will need a stressor from ecological system. And when we say ecological system, we're talking about the climate change that could change a vector population. And also, if there's any degradation in natural habits, then we will have like the move of the wild animals near to the human and the domestic animal, which cause the amplification. This figure already, is there any pointer here? Yeah. So this figure already has shown by Dr. Yashpal as showing, for example, like if there's any stressor from ecological system, we'll tend to see like the wildlife to actually travel and get closer to the domestic animal and the human, and that will lead to the amplification. On top of that, the natural change, degradation, natural habitats will cause an increase in the vector population, which actually will increase the spillover on the domestic animal and also human. This is not the lovely figure that we want to see. We want to see like a separation on the red part here and that one as well. So there are some scientific insight that come from the international organization like WHO and WOHA regarding the zoonotic disease. One of them, we know that's 2.5 billion of the cases in the human as caused by the zoonotic disease, and 75% of the emerging and re-emerging are zoonotic. When we say like this cause, whenever there's like an infection in zoonotic disease, there's always like a health and financial outcomes. And that lead to reactive responses, unfortunately. We don't want reactive responses, we want to be a proactive. Usually it will end up like with having a large economic burden, like according to the WOHA, there will be around 22 to 31 billion yearly actually are spent on the preventive measure for zoonotic disease. Therefore, we need a one integration system and approach where we can look at all of these aspects. And if we have to simplify what is One Health concept, is basically one all relevant sector. And when we say relevant sectors, is the human, animal, and environment. They need to work in a coordinated way, not in a silo, in order to give an efficient and effective and sustainable, proactive intervention or responses. And if you see this figure, it's just simplify why this is very important for us, because as we say, there's a direct exposure like that. The environment can affect the animal and the human. And this direct exposure could be through the food webs, or it could be indirectly through the degradation of the habitats and also the movement of the animal and the climate change. And also we have the zoonotic pathogen. This is interconnected things as said by other speakers. But again, the importance is actually of the One Health concept is the fact that it is actually all of these three interfaces or sectors are interconnected and linked. And the second thing, there is a huge burden on the economic if we don't implement the One Health concept. The last thing, the fact that currently, with the bar diagram of what exists in the majority of the countries, is that we are actually approaching the reactive responses, not being proactive. And COVID-19 was one of the best examples why we have a reactive response. The second thing, in order if we implement some integrated system like One Health system, we'll be able to prevent the downstream effect like the health and financial outcomes. The last thing, the majority of the governments, and that's normal, is actually structured by sector and division. And that's normal for the nature of the work. But actually that creates some sort of artificial boundaries that we don't want. Therefore, like we believe that One Health is actually acting as a sound management where we can actually minimize these artificial boundaries and hopefully to lead to certain effective and efficient sustainable responses which work in a coordinated way. So if you go and check, if you go to the international organization, they release the operational framework, whether it's UNEP, WHO, WHA, and FAO. All of them, they share the same pillars that we need to tackle and look at if you want to implement the One Health in practice. If you want to implement the One Health practice, you need to have a governance and management, and that's very important because it will actually set a clear leadership and coordination mechanism. The second thing you need a network or partnership, and this is very important to facilitate the collaboration between the governmental sector, between the private sector, between the academic institute, not only at national level, but also at regional and international level. We also need a workforce development, and we need to develop a multi-skilled workforce through training and capacity. Also, we need a surveillance, and we need to have a joint real-time surveillance program and response in order to achieve what we call the effective One Health approach. And also, we need the communication in order to facilitate and ease the data sharing between all stakeholders that are involved in the One Health. We need also applied research in order to add more investment on the applied research to understand for example, the nature and the mechanism of the zoonotic disease and zoonotic pathogen. We also need a monitoring evaluation. You don't only implement the One Health, you need to monitor the One Health that you implemented and also to see the progress, and then you evaluate it and tackle whatever area that need to be improved. So this is basically what the majority of the operation framework of One Health, and that was suggested by the international organization. And hopefully we want to have something like this later on, because we believe like if we implement the One Health, we will have something like a forecast readiness and early detection. This will actually, hopefully, it will drop the spillover to the domestic animal and also to the spillover to the human. So ultimately, we are looking for something like this, or globally, they're looking for something like this. So who we are Abu Dhabi Agriculture Food Safety Authority. From the name itself, it's clear. So we are the local authority in Abu Dhabi. Abu Dhabi represents 86% of the country almost, okay? And we are in charge of the agriculture, food safety, food security, and biosecurity. As any organization, we have a vision where we want to seek the global leadership in food security, and that's why we launched multiple strategic programs. The thing that I'm gonna focus on here is the biosecurity and the food safety. So we have a division called Biosecurity Affairs Division. And I always like to simplify things. This is just the execution arm of all the biosecurity activity that is conducted by ADAFSA, as simple as that. However, if you read the operation framework of the international organization, one of the major things in order to establish the One Health framework, you need to identify the capacity that's currently existing in your country. And Biosecurity Affairs Division has a really good capacity because they are internationally and nationally recognized. Because we are recognized as a WHA Collaborative Center for Camel Disease. This means that we are a reference center in camel disease globally. We ought to do some activity at regional and global level. And also we are WHA Collaborative Center and Quality Management System. And national also, we are a part of the WHO cabinet of the UAE. So we represent the livestock part, and SKMC, which is Sheikh Khalifa Medical City, represent the human part. Also, we are the national reference for the CCHF, for PPR, MERS, and AMR. The Biosecurity Affairs Division have mainly 5 sections. The first one is the reference laboratory, which is basically conducting the all routine work, veterinary lab test work. We have 4 laboratories. We have one in the eastern region, and one in the western region, and we have the one in the central, which is Abu Dhabi. On top of that, we have the mobile lab. We have the biobank, which is in charge of storing all the primers, isolate, quality control that is needed with the capacity over 25,000. We also have the biosecurity risk assessment, which mainly in charge of conducting and preparing all the risk assessment in a One Health approach using because we developed this one along with the human-related organization and also environmental-related organization. We have the reference laboratory, which is the R&D arm of the Biosecurity Affairs Division, and we have the technical support section, which provide all the logistic and support. So the story of the One Health, like Adab said, started a long time ago. It was in 2014 when we launched the first guideline of the biosecurity general aspects. And that one was in 2014. It mainly gave a guideline how to prevent the exotic pest and disease from entering and spreading and actually becoming established in Emirates of Abu Dhabi. Followed by in 2018, where we released the first biosecurity strategy, which has 6 strategic objectives and around 15 initiatives. Then we were thinking that there should be like a committee that oversees this thing. And then we established the Biosecurity Steering Committee to oversee all the activity that is actually mentioned in the biosecurity strategy. Later on, we have invested a lot in one of the giant projects, which is the biosecurity program. It has 8 projects in it, which I will highlight here in details. The first one, it's establishing the One Health Committee in Emirates of Abu Dhabi. Second thing, establishing the One Health Laboratory Network. Third thing, we established the Digital Legislation Library. We have developed with the FAO is the Integrated Biosecurity System. And also we have, the guideline for the transport of biological materials. And also we have the whole initiative that's putting the training program that is needed in One Health. Other things we have like the real-time surveillance program plus response plan. These in general are the 8 projects that we conducted. I will start up with the One Health Committee. We established this one after we conduct a SWOT analysis and also benchmarking with the top example of the country that they implemented the One Health, like the Denmark and Thailand, Australia, and we took one example in the region like Qatar. So the One Health Committee, it has 2 layers. It has the political level and it has the technical work group. The technical work group consists of like a 5 technical group. There's a group related to the zoonotic and epidemic, and we have a risk assessment group. We have AMR, agriculture, animal production group, laboratory group, and emergency group. This has like experts from academic institute, from federal authority and local authority in Abu Dhabi. On top of that, we have an expert from the international organization like FAO and WOHA and WHO. So what they basically, this technical group do, they provide the scientific recommendation to the political level group. And the political level group, you would see that we cover the majority of the interface that's needed for the One Health. So we have the Environmental Agency of Abu Dhabi. If I have to simplify this, they are more in charge of the wild animal and wild plant. And also we have Abu Dhabi Agricultural Safety Authority. I've already introduced it to them. We have the Department of Health, is mainly the human. We have the Department of Municipality and Transport. We have the Abu Dhabi Public Health Center. We have the Clinical Defense. We have the Emergency Crisis Disaster Management Center, which oversee all the crisis management like in the Emirates of Abu Dhabi. We have the TUI, which is in charge of the waste management. And we have Abu Dhabi Quality Conformity Center. They are investing a lot on the food labs. So the role of the political level here and the One Health Committee is to oversee all the One Health initiative and also to escalate the needed recommendation that's raised by the technical work group. Also, they make sure they are aligned with the federal authority because we are part of the other federal authority like MOCA and Ministry of Industrial and Advanced Technology. Also MOHAB, which is the Ministry of the Health and Prevention, and the National Emergency Crisis and Disaster Management. So we make sure that we integrate with the federal level as well. So the first project that we actually, we were planning to actually to launch it on the GarcX, but unfortunately, due to some technical issue, we postponed this a little bit. So what we did, we established a One Health laboratory platform. So basically, this is the major reason behind this one is to expand the scope of laboratory test and increase the emergency capacity while ensuring the business continuity. Currently, we have 5 laboratories. They actually integrated with us. We have laboratory, ADAPSA laboratories, Department of Health, ADQCC, which is Abu Dhabi Conformity and Center, and we have Al Ain Zoo, and we have Abu Dhabi Falcon Hospital. It consists of 8 modules. The first module is test. It just shows all the tests that are conducted by this laboratory. It also has a module for proficiency testing. So if we actually at ADEFSA are having the ISO 17043, so we are BT provider. So whenever there is a need for any BT proficiency testing for all the laboratories, we can put an announcement here. And also the other laboratories, they can announce for any BT in this platform. We have the biobank, which will give the details of all the ISO that exists on this laboratory, and also the quality control department that is needed. It has also the repository, which put all the information about the facility and the equipment, the expertise that exists in each laboratory. And also they have the training hub. If there's an announcement for training that's related to One Health, it will be there in the platform. Also, we have the technical forum as basically a space where the technical discussion can happen. And also we have the research and publication where we can actually advertise for it here. So basically the reason behind this one is trying to put all these laboratories all in one platform, because previously what we used to do when there is like a cases are reported of the zoonotic disease, there will be like ADEFSA will start to send an email to Department of Health and they need to respond. But now we have one platform. Whenever there is a cases that are reported and a positive cases, the alert will become here, and all the laboratories that are integrated in this platform will be notified, and the assigned team for the emergency response can take action immediately. One of them, the importance of this one, this platform is already integrated with Jahazia platform, which I will be mentioning at the end of my talk, because everything is integrated in one system. Second thing we developed with the FAO, in 2021, we signed an agreement with the Food and Agriculture Organization to co-develop Integrated Biosecurity Index. It's basically a tool that used to assist the participating organization or any governmental entity in order to manage and monitoring the risk related to the biosecurity. So it covers the agriculture, the food, and other One Health related sectors. How it looks like is basically it has 6 principles, the tool. There's a principle related to the One Health and the capacity, another one for the surveillance and emergency preparedness. There is a principle for the supply chains, public awareness, policy and regulatory framework, and also operation. Each principle had different criteria, and each criteria has indicators. So we have in total 124 indicators. The theory behind the integrated biosecurity system is basically, if I say this table represents one organization, they will start to apply the integrated biosecurity system, and they will be evaluated based on that things, and it will give them like alert which area they need to actually take a decision against. For example, if they want to amend or update certain targeted policy or any investment they need to put in, and then that will help them to sustain the value chain and food safety, for example. This is an example. And later on, they can reassess themselves again to make sure that they achieve what they wanted and they overcome the alert and the challenges they had. And again, it's a continuous improvement cycles where they have to keep to take them, this integrated biosecurity over and over again. Second thing, when we did the SWOT analysis, we noticed that the regulation, the law, the legislation of One Health are scattered, and they need to be in one platform. And what we did, we actually developed like an integrated digital legislation platform that has all the laws, regulation, and also the policies that are related to One Health. So now this is active already. It can be accessible by all the stakeholders, mainly in the One Health committee, and those who are involved in the One Health. So we have around 35 federal plant legislation. We have around 31 of the livestock legislation. We have 17 of the federal food legislation. On top of that, we have other federal legislation that are related to the One Health. In addition to the local and ADEFSA regulation and policy, this is supported by database management system. It has an indexing system where it facilitates the search, and also it has a notification system in case if there's any update or a change or a recommendation that's raised by other stakeholders. This can also be accessible to the smart app that is used by our inspectors. In order if they want to detect any violation, they always go back to the regulation and the law we have. So other thing that I want to highlight here, this is handled by the control sector. It's one of the largest sectors in the ADEFSA, I think they have more than 200 to 300 employees because they have so many inspectors. They have developed the food inspection system, which is that one. This is the interface, looks like this. But this is fed actually by different mobile app and application. One of them is the smart control, so any inspector, they want to go and assist any food establishment, they have the smart control, which is actually based on the guideline of ADEFSA, of the FAO, of the ISO 1702, of the ISO 22000 for any evaluation that's related to the food preparation and food safety. Second thing, we thought, okay, if I am the owner of the certain food establishment, maybe I want to do a self-inspection. Whether that helped me. So we developed the self-inspection app where any food establishment owner can actually do its own self-inspection and upload the evidence that is needed. And based on that one, we can do the remote evaluation. But it doesn't mean if I did the remote evaluation, that means you pass the scoring. We may actually do like a sudden visit to your establishment to make sure that what you uploaded is correct. The last thing, what we did in order to raise the awareness of the community, we have published the public digital food safety rating, which is called ZATNA. So after the visit, by the inspector and the self-inspection, you tend to have a scoring, and that scoring has certain compliance level, as shown here. And the ZATNA rating application will show, if you go to any restaurant, you will want to make sure how good they are in terms of food safety, you will see the rating here. And it's compulsory, all the food establishment, they should apply this one. They should have a sticker actually in the food establishment entity to show like the rating, at least in Emirates of Abu Dhabi. So did we stop here? We said, no, we actually need to expand more. So what we did, we actually now working on the proof concept of the visual monitoring system, which is supported by the smart cameras. So we're working now with the 25 food establishment on the proof of concept, where we actually installed a smart camera to detect violation. And also we have the IoT devices that monitor the certain condition like the humidity, the temperature, and if there's any water leak in the area of preparing food. By applying the machine learning and artificial intelligence, we hope in the future to be able to remotely evaluate like these food establishments and actually minimizing the waste on the resources of the human resources, and we hopefully to reduce the number of inspectors, because every year we have an increase of around 1,000 to 1,500 food establishments that actually just in Emirates of Abu Dhabi. So the number is increasing, and there's no way we're going to recruit so many inspectors. So why we believe applying this visual monitoring system will be hopefully an ultimate solution, or at least to help us to make sure that the food safety is in the right place. So all of these systems that I've mentioned previously, all of them are linked in one platform, which is the Hadiyah platform. And this is a platform actually ADEFSA used in order to monitor the early warning and emergency response and crisis management. This is how it looks like, the interface of it. And this is the operation room where the team actually looking at the Jahaziyah platform, and it's 24/7 hour, so it's always active. So basically, ADEFSA started this one in order to monitor their enterprise risk, but then they expand to include the human, animal, and environmental in one integrated, one health framework. So this Jahaziyah platform has won the Arabian Best of Best Award, a titanium winner. And also the good things that we did not only integrate all the internal system of ADEFSA, because in ADEFSA we have the veterinary management system, we have laboratory management system, we have the food inspection, as I mentioned, we have now the One Health Laboratory Network, but we also integrate the other system that exists in the Emirates of Abu Dhabi, like the one in Department of Health, and also we are integrated with the international organization like the WHO, WOHA, and FAO. So we have the interactive dashboard in real time for all of these things. So it has different modules. One of them is the risk register. It's basically incorporate all the risk register of the ADEFSA business unity that will help ADEFSA to actually make risk-based making decision. Especially we report, if you go to the news last year, we had a really good storytelling about this platform when it comes to the risk register during the heavy rainfall we had. It's actually helped us to target the surveillance for certain vector-borne disease like the dengue virus. The second thing, as I say, it's integrated with the international organization. So if there's any alert outside the UAE, we will get a notification on the system, and also will make us to do any proactive and preventive measures that is needed. The last thing, as we have an access as ADEFSA, we are having an access to over 25,000 farms in the Emirate of Abu Dhabi. We have huge, large data set, and we're thinking, okay, we should actually take this to different level and implement it in Jahaziyah. So we have developed the animal disease spread model, and there is a paper already published about this one. So what basically, based on the data that we have, like geographical distribution, the vaccination history, the movement of the animal, and the distribution of the farm, we managed to develop like a model that helps us like, to predict any spread of the disease, of zoonotic disease. And one of the success stories was the PPR. I will be very happy to share the publication with you later on. It actually helped us like to minimize the vaccination that is needed. It was targeted surveillance, targeted vaccination, and also utilize the resources, the human resources much more efficiently. The last thing, as you see over this presentation, I tried to tackle different pillars that was mentioned in the operation framework. One of the last things is the applied research. We have established One Health AMR Biosecurity Consortium along between the United Arab Emirates and also UK. We have 17 entities in the United Arab Emirates along with the UK, where we have established what we call One Health AMR Biosecurity Consortium. And this one, recently we have received the approval to conduct one of the giant national AMR study, where we are about to sequence all the archive Escherichia coli that was collected from 2020 to 2024. Luckily, we at ADAFSA, we've been doing this practice a long time ago, even before we were thinking about One Health. So whenever we detect any disease, we make sure like to preserve the isolate in the biobank. We believe like that will generate some study and later on. Today, now we have shown a good example in comparison with all the entities here, that we had the majority of the isolate exist at ADAFSA entity. So hopefully, we believe this study will allow us actually to understand the transmission pattern and the transmission and spread pattern of Escherichia coli, at least, of this infectious disease in the Emirate of Abu Dhabi. Not only Emirate of Abu Dhabi, but the whole UAE. Sorry for this. And we're not only targeting the Escherichia coli, but we will start with the Escherichia coli. Later on, we will expand. It depends on how many isolate do we have. So how all of these things look like all together, because I mentioned so many initiatives, but how they look like. So basically, we have the internal operation that actually running by ADAFSA, and we have the external. So when it comes to the internal, this is all the biosecurity program that I was mentioning. I did not really mention all of them. I all highlighted 4. And on top of that, we have the ADAFSA daily operation, like the inspection, the routine diagnosis, emergency, and risk. All of these things with different internal systems, they are integrated in Jahaziyah. And based on the Jahaziyah, the action will be taken by ADAFSA teams, whether to the farm, private sector. On top of that, whatever is generated from the research outcome in collaboration with the research institute and also collaboration with the government and sector will fit in Jahaziyah, and then we'll take action against. All of these things will be overseen by the Abu Dhabi One Health Committee and also aligned with the National and Federal Committee.